Now, South African health officials just approved a child-friendly 4-in-1 antiretroviral treatment for young children living with HIV.
Experts say it's a significant improvement over other formulas that have been used in South Africa. While medical advancements are happening every day, in the meantime, living with HIV is still very real. Just here in the U.S., 37 million people are estimated to be living with HIV, and the rate of contraction remains alarmingly high. So joining us live to have conversations that will break down the barriers to treatment and help people live positively fearless, ambassadors and HIV advocates Daniel Garza and Kamaria Laffrey. Good morning. Thank you both for joining us.
Good morning. Thank you for having us.
Well, Daniel, I guess I want to start by asking you, tell us, what's the most challenging aspect of living with HIV?
Sure. First of all, thank you for the invitation on behalf of Positively Fearless and Janssen Pharmaceuticals. We're happy to be here. One of the most challenging things about living with HIV, especially in the Latino community, is the barrier when it comes to language. Also, social norms, culture, and religion just feed into the stigma, the shame, and the silence. And it stops us from having the conversations when it comes to sex and sexuality. So I think right now that is still one of the biggest barriers that we have, even 40 years after the first diagnosis.
Kamaria, as a woman living with HIV, what have you learned over the years to help you live what you call positively fearless?
Yeah, so thank you for that question. That's been a journey. I've learned to live with intention so that I can advocate for myself and have those fearless conversations with myself, preparing myself for the possible outcome of disclosure and navigating conversations with healthcare providers. And it's helped me build community. It's helped me identify what works for me and what doesn't work for me. And it's been something that like I said, it's a process. So I learn new things every day, especially through my community at Positively Fearless.
I think, being able to have those conversations, it's so difficult. There's still so much stigma for people to be able to talk, even with their friends and family, let alone medical providers. Daniel, you mentioned, for the Hispanic and Latino community, there being some additional language barriers there. How does that affect the treatment opportunities and what's available for people to continue to live their lives?
Yes, of course. When I was diagnosed back in September of 2000, for every one Spanish pamphlet, there was about 20 in English. So we didn't have access to all the information that was available. And even today, we are a country of immigrants, and people who are monolingual have sometimes a hard time accessing the information that they need to be their own advocates when they go talk to their healthcare professionals. So being the Latino face for Positively Fearless, I'm happy that I can provide the information in two languages so that anybody with any questions can come to me and I can point them in the right direction.
Yeah, Kamaria, what kind of advice can you give to others who are in this situation?
The advice I would give to other people who are newly diagnosed, living with HIV, or navigating how to get tested would be to find, well, one, you can go to positivelyfearless.com and find ways to have those conversations and access to information, as well as other ambassadors that they can relate to identify people that have commonalities. But I would also give the advice for folks to go through the process internally, be okay with their fear. Just because we're ambassadors doesn't mean we're not afraid. There's a lot of things that we do in our advocacy and navigating life, living with HIV, that comes with fear, but you push through anyway. So I would give the advice that it's okay to be afraid, as long as you keep showing up for yourself, prioritize yourself first, and operate with intention of what is your intended best outcome for whatever those conversations and actions may be.
Well, we certainly appreciate both of you speaking up and sharing your stories and hopefully helping open those doors and making those conversations a little easier for others. Daniel and Kamaria, thank you both for joining us this morning.
And for resources about living with HIV, you can find it on positivelyfearless.com.